Hey guys, how are you? Today I want to take a moment to show you what a grafted site looks like under cone beam CT scan. So here's 3D rendering of the site number 19. So this tooth 19 has been extracted. At the same time of the extraction, the graft material was placed in, and several months later, this site was cone beam CT was taken at this site in order to evaluate the shape and size of the ridge as well as the status of the graft material. Our goal is to make sure that the material is fully osseo-integrated to the surrounding trabecular bone and cortical bone as well. And so that's what we want to see. Okay, so what I have here is a 3D rendering of the area along with highlighted or traced mandibular canal, and that is something that I have done myself in order to make sure that when the doctor is treatment planning an implant, that I want to give that person an accurate measurement of the ridge. So that is something I do for every mandibular scan. Now let's take a look at the scan in all three different dimensions. But what I want you to pay close attention today is this particular sagittal view. So let me zoom in or maximize that view. I'm going to scroll through the sagittal plane, okay, buccolingually, and without going too much in detail and of other areas, I want you to see the overall outline of the graft material along the alveolar crest. Is it smooth or is it irregular? Okay, it's a little bit irregular for me. I hope you saw that. There are spicules of graft material. Okay, I think I should say one more thing, since you probably never looked at what a graft material looks like on cone beam. First thing that I want you to notice is that the radial density of the graft material or the pattern appears different from the surrounding trabecular bone. By now, just from periapical radiograph, you know that there are some characteristic trabecular patterns depending on which area of the mouth, which area of the arch you're imaging. But you see that for graft material, there is no pattern. It's just heterogeneous radial opacities. You can almost visualize that the material is being packed into this distal socket and the mesial socket. Okay, so having said that, let's look at the crest one more time. Okay, it's a little bit irregular and the alveolar crest has not been fully established, which I don't know exactly the date of the surgery, but which tells me it's still undergoing remodeling. Additionally, another area that I want you to see is right here, this radiolucent area. Let me remove the crosshair. It did not like that. Okay, let me cancel that. Okay, I don't know what just happened, but let me zoom in just a little bit. Okay, whatever I did, it's not liking it very much. Okay. All right, let's see. Well, I do see a radiolucent area, especially here where it's clearly has yet to be blending to the surrounding trabecular bone. So those are the areas that I'm still concerned that this is not fully integrated. But other than that, rest of the area is primarily integrated to the surrounding trabecular bone, and so I like that. You know, I don't know what the surgeon and the patient's timeline is, but you know, if this was say one of my family members, we could probably go ahead and place an implant now, but it probably wouldn't hurt to wait another couple more weeks before placing a dental implant. So that's it for me, or for this video. I just want you to show you how the graft material appears on cone beam CT. Thank you very much, and I'll talk to you later.